Well, hello there. Welcome to another edition of Suzy's Las Vegas. I've got a very special show today, and I'm excited to bring it to you. And I want you to remember one thing. Be sure to like, subscribe, and share if you like what we're talking about. Today's going to be an awesome show. I've got Smile Oasis here. I've got Avin and Kamal, and we've got a show that you possibly cannot miss. So, with further ado, here they are, Avin and Kamal. Hi, how you guys doing?
Thank you so much for having us.
Yes, we're very excited to be here.
I'm excited to have you here. I'm learning all kinds of fun things. And we're East Coasters. Who knew? Oh, my God. New York, Chicago, Pennsylvania. I mean, come on. Half of Vegas is East Coast. So trust these guys.
Honestly, there's a special bond when you meet someone else from the East Coast.
Doesn't it make you feel good?
It does.
Yeah.
I get very excited.
Yeah, because you know you can trust them. There's a big difference, isn't there?
Yes,
yeah.
There is.
Definitely a different vibe.
So today we're going to talk about implants, aren't we?
Mm-hmm.
We are.
Oh,
Absolutely.
Okay, where do we want to get started?
I know implants are really modernized now, and it's a great way for teeth replacement. So, what questions does the audience generally have about what dental implants are? I think a great way to start is, what is the foundation with an implant? What is it made of? How does it work in the mouth? So implants are essentially a biocompatible material. It's titanium, and it goes into the jawbone, and then the bone will grow into it. It's called osseointegration, in which the implant stabilizes.
All right.
So now that can be used to replace one tooth or multiple teeth, like a bridge, or a whole row of teeth called an all-on-X, all-on-4, or all-on-6 style treatment. So this is stuff that we do in the practice. Alvin and I have been doing it for quite some time. We actually teach implants as well. So,
you do?
Yeah.
Oh, good.
Yeah. So something that we're really passionate about.
So I really want to talk to you about it. I only had them done on the right side, and it was 2 posts, but there were 3 teeth, and it was on the back. It was on the top.
Gotcha.
And so, that was done probably, maybe 6-7 years ago. So I'm sure from then till now, a lot more things have changed and a lot more things have happened. So fill me in on like say a person goes in and, I have a lot of people that I talk to. And some people will stay with, what do they call it, where they snap... what am I trying to say?
Like dentures?
Yeah, the dentures.
Okay, yes.
They do the dentures and because they're afraid of what the cost is going to be, or is it going to be painful? Yeah. What's going to happen with this? So maybe
absolutely.
You can walk us through this on how does one person find out, is the implant right for me?
Yeah.
Is really what I want to know.
So implants definitely have come a long way, but also the patient population. Nobody wants dentures anymore because
no.
The biggest fear is you're talking and then dentures fall out.
Yes.
And that's like the biggest thing I hear all the time. But the great thing about implants is it's a secure way of holding that denture. And there's 2 different options. One is a snap-on, and just like Dr. Kamal talked about, the screwed-in denture.
Okay.
And what's great about it is you don't have to have glue. You don't have to worry about eating your favorite steak and then it just drops, or even while talking.
Sure.
But we do have a video where we want to show how an all-on-X works. So
maybe
basically,
we can show that.
Yes.
Yeah. There it is.
All right. So
if we want to talk through the process a little bit here. So we can see this is an edentulous jaw is what we call it. There's no teeth currently present. So you can see the implants are going into the jawbone there through the gum tissue, and then a fixed set of teeth would come in and be screwed onto those implants, and they're supported simply by those implants. So with an upper row of teeth, generally with a denture, it covers the entire palate, covers the roof of your mouth. You end up losing a lot of your taste buds and sensations that way, and that's the biggest complaint that we get with patients, that they can't taste their food anymore. So with a row of teeth like this, where we're able to just fixate around the jawbone and not actually cover the roof of the mouth, patients get their quality of life back. They get their happiness, they get their ability to chew and laugh and eat, things and taste their food the way that they used to. So it's a great way to replace the teeth.
Yeah. And you only once a year, sometimes twice a year, come in, and then us as the doctors will clean the denture for you.
Oh, you clean them?
Yep.
Okay, great.
Yeah.
So take me through the process. Okay, so I come in and I want to do this. Do I do the top teeth first? Do I do the bottom teeth? the pricing, maybe we can get into all that. I mean, I would really like for me to know and also for our audience to know.
Of course. Yeah, absolutely. So we start with a consultation. So we figure out what your goals are, what your needs are.
Okay.
The implant treatment has to be a good fit for you and your lifestyle. And also just with medical complexities, you have to be a good candidate for implant surgery. So granted, all those things are in place, and we have the need for dental implants, with what we call terminal dentition, in which case it's not feasible to restore the teeth anymore. It's better to have them replaced with the dental implants. We do the consultation process, and then we walk through essentially what the treatment's going to look like. Generally, if we need to do the top row and the bottom row, we do that in one appointment. And we deliver teeth either the same day or the next day.
Yep.
Really?
Yep.
So you mean you're not without the teeth? And
No.
Exactly.
You take them out and put another set
You
in?
get to walk out with a new, fresh set of teeth.
How long does this take from start to finish? Do you go in the morning at 6 and you're done at like 9 or 10 at night, or is it?
If we were to start at 6, generally sometime midday, usually around 2 or 3, we'd have your teeth in and you'd be on your way. Surgery itself takes maybe about 5 to 6 hours, and then it takes maybe about an hour or 2 to get the teeth ready. So this is including the anesthesia. This is including taking all your records, your scans. Our office, we do everything digitally. So we have photogrammetry, we have scanners. We don't need to do all the goopy impressions anymore.
Oh,
we don't,
good.
Yeah, everybody hates
so
I
it.
remember that. Oh, it
Yes.
was so awful.
Especially if a
Which
big
means
gag
we can do
reflex.
everything custom as well. We use your pictures, we design the teeth to your face. So we use your symmetries and make sure that the smile looks good for you in particular.
Yeah.
And then we give you essentially your healing set of teeth. And these are good because it helps the implants actually heal and osseointegrate as well.
Okay, so the healing, what is that, your temporary teeth?
Essentially, yeah.
Yes.
So they're made out of 3D printed resin, very, very strong, durable. You're on a modified diet for the first 3 months just to allow the implants to continue the healing process.
Right.
So we're not
you're
overloading them.
You're not chewing anything hard or...
So we say
it's
anything...
Most lighter.
Anything you can cut with a plastic fork sideways.
Oh, okay.
Which would be actually
That's
quite
not bad.
a lot of
Quite a
food, like
lot.
lasagna, any sort of pastas, mac and cheese, mashed potatoes, eggs. It really incorporates a lot of diet. So
that's
just
good.
nothing too hard. This allows the teeth to heal.
Okay.
So not too much of a lifestyle change.
No,
Yes.
not really. I mean, this is sounding better and better. I might be a candidate. Who knows? Maybe these boys will tell me that, I could be a possible.
Yeah.
Yeah. It's interesting. Most people are afraid to ask the questions.
Yes, of
they
course.
really are. And then they're afraid of, what happens after this, after that. Because, back 10 years or 15 years ago, you heard a lot of positive, negatives to this whole thing.
Absolutely.
And I'm sure it's come a long way, hasn't it?
Oh,
I mean,
it has.
there's another option that's a patient's favorite is the snap-on denture. So if finances is an issue, it's kind of a middle ground between a regular denture and a screwed-in fixed denture.
What's that?
So it's called an overdenture.
I'm learning new things,
So we
boys.
have another video for the viewers.
Okay.
But basically, it's another option. It's kind of the middle option. And it's where it snaps on. Let's see if we can get this video.
Yeah, Rick, let's see if we can get the other video.
Don't have it.
Oh, okay. I think it should have sent. There should have been 2 there.
Okay, I'll check.
Yes.
Okay.
But just
All
as an
right.
explanation,
Yes.
essentially
Kind of
what we do is we make what a traditional denture looks like, and then after the implants are placed, they get little caps put on top, and then it snaps into the denture, kind of like a button. It clips
And
together.
on a jacket.
So it
just snaps
helps.
on.
It helps the denture from
Is it
falling
kind of
out.
like a crown type deal?
No,
or
it's the same as the screwed-in denture. Instead of it being screwed in, it actually just clicks on.
It clicks on.
Yes.
Okay,
Yes.
but that can come out easier, though, can it?
Yes.
It can.
Yes.
Easier, but it's not as it's kind of that middle ground. So it's not like using a denture where it's moving around, and it's not like a screwed in fixed bridge. It's something in between where it's a denture, but it clips on.
Yes.
Oh,
So
okay.
it won't come out, but it does have a little bit of movement and give to it.
Yeah.
Okay.
So it's for patients where, if finances is an issue, but at least all you have to do is take it out at nighttime. But throughout the day, you can eat with it and talk with it and don't worry about
And you don't
falling out.
have that bridge across the top then, do you? It's,
We can shrink that. Yep.
Yeah.
it's not the same as a denture then, or it is the same?
It's basically, so you have your regular denture, which
Correct.
gets glued in.
Yeah.
And then the middle one with the snap-on, it's implants, but instead we can remove some of the outside and then let it click in.
Oh,
Yeah.
okay. So it's a lot better than the old-time dentures where you have to clean them and then put them in and you have that whole bridge across the top. And what people say they can't taste as well with that.
Yes. Mm-hmm.
Yeah.
So yeah, it's not quite as like easy to use and sexy is the all-on-4, all-on-6 type screwed-in one, but it's definitely a huge step up from just a traditional denture. The way we explain a traditional denture is kind of like a soap on a soap dish. I mean, the lower is really, really hard to retain just because there's no suction to it. It moves around a lot. Over time, you can get used to using it. And that's what most people have done for a long, long time. But that initial stage, that initial year or 2 years, it's just a lot of training. It's like having a prosthetic arm or a leg. You know, you can't run the next day, and it takes a lot of time. So this
with the old-fashioned
exactly.
Well, the ones who benefit a lot are, you know, if you've had missing teeth for a while, and then your jaw is a little bit too thin that a regular denture can't sit on.
Correct.
Even as little as 2 implants, it can just snap in, and then that's enough to hold that denture in place.
Really?
Yeah. So a big improvement in quality of life, even as little as 2 implants.
Wow. Well, you guys are amazing out here. You know, I'm glad you're on a show today. I'm glad we're talking about it. I'm learning a lot of new things. I mean, this is so give me an idea from the time you say I'm a patient and I want to come in to see you. I set up an appointment. Walk me through the steps of what it takes to get from point A to, you know, point C or D, you know, till we're done with this thing. How many steps do we have to this? I come see you. What's the first thing you do?
So if we're doing the screwed in.
Oh, perfect.
Oh, you found it? Great. We want to show that.
Yes. So here basically you can see the implants being placed. And then as soon as they heal, we place these attachments, or what we call buttons. And what that does, it attaches to the implant. And then what you'll see in the next part of this video is on the underside of the denture, there's the other side of the button.
Oh,
and then
all right.
what they do is you just place it and it clicks. You'll hear that click or feel the click.
On the bottom and the top.
And then once it clicks in there, it stayed in place. It stays put. And then at nighttime, you just take it out, you know, clean like a normal denture. And you wear it again in the morning.
Okay. That's amazing.
Yes.
Wow.
So it's kind of like a middle way if you can't afford, or, you know, in terms of finances, a little bit out of reach. It's kind of middle ground.
So do you do your own financing in-house, or do you have a company that a person would come in and talk to find out what they can afford and, you know, what they can do?
Yeah, absolutely. We offer multiple third-party financing options that we can go through, and generally that's a great way for patients to get started, because some of these treatments, I mean, they do get really costly because of how much implants cost and the lab costs behind it, but the financing options patients really enjoy.
Okay, so give me an idea. I come to see you, and I think most of our people have seen a lot of things out there, like on pricing. So say a starter set, the second video that you showed us, what would something like that cost if a person came in and say they had dentures, if you will, and they want to go from not wearing their dentures that they've worn all their life, and they want to switch over to that, or possibly move up to, you know, the Cadillac, I guess is what we want to say, or the Mercedes.
Absolutely. So the clip-in ones generally run about $8,000 to $10,000 per row of teeth. So for
the bottom and then for the top.
Exactly.
So you can roughly get, you know, $16,000 to $20,000 in that
for both. Yes. And then the screwed-in ones are about $20,000 with the anesthesia and sedation.
That's for each.
Yes.
So it's $40,000. That's what we're looking at. Okay. Now, what do you guarantee on this? This is a good question.
No, of course, and we get that all the time.
I've heard, you know, a lot of stories. That's why I'm asking you these questions.
Great question. So a lot of it has to do with the initial portion has to do with the surgery. So we guaranteed the surgery for 2 years, and we guaranteed the prosthesis for 7. So this is with the intention that our patients are coming back, getting things cleaned, getting things checked out. Now, if something happens in between here where it's not the patient's fault, we absolutely take care of it, no questions asked. 7 years, you know, this makes, if in our minds, if something's going to last 7 years and it's being taken care of properly, it can last a lot longer.
Sure, it lasts a lifetime, really.
Well, the most important is, you know, the maintenance appointment.
Well, sure,
so coming in, making sure you get the
maintenance.
cleanings and getting the proper x-rays to monitor the implants. Make sure everything's taken care of.
Does your mouth change, you know, like once you have this done, this is another question that I'm curious about. As we all age,
yes,
nobody wants to get older, but
no.
We do get older. But when does your mouth change at all, or does it pretty much stay the same?
We see a lot of reverse aging with this.
Yes.
A lot of reverse aging. Mostly because
that's what I want. I want reverse aging.
Our
now
patients,
you're talking.
Yeah. Yes. Our patients that generally get this done haven't been happy with their teeth and their dentition for a long time.
Right.
So when you smile without confidence, you smile by just kind of hiding your row of teeth.
Sure.
And when you get this treatment done over time, as you start to reuse these muscles, your face will start to slim down and you'll start to reactivate portions of your face that you haven't used for a while. So it starts to anti-age the face.
Okay.
And on top of that, when you've been missing back teeth, your face starts to sag over time.
Sure.
So this is what we try to explain to our patients when they're losing teeth in the back, that, hey, over time, this is going to start to affect the way that you look and the rate that you age. So once we get the teeth back in, you can see, we can show before and afters at some time, and you can see how different somebody looks. It takes immediately 10, 15, 20 years off. It's incredible.
One of the other great things about implants is it keeps the bone there, the levels there.
Oh, so it does?
If you don't have implants, our bone actually shrinks. So when you lose that volume,
that's
why we're fighting against gravity, basically. But when you have implants, what it does, it preserves the bone there. So you're still maintaining that bone height, which is great. That support.
Wow. Yeah. That's wonderful. I had my implant done back 6-7 years ago. Okay. But when they did it, I'm sure things have changed since I did mine. They took the teeth out, but then they had to add bone to it, so I had to have that done. And then what was it, like 6 months later, then they put the screws in, and then they have to heal, and that was almost like a year type process on us. So your process on what we're talking about is a whole different thing here, right?
Yeah. The mechanics behind implants have changed quite a bit. This process in particular allows us to load the teeth immediately.
So good.
So it's different than if you did a single unit or a bridge. If you were to do a whole row of teeth, you have cross-arch stabilization. So that means your left side of your mouth and the implants are actually helping stabilize the right side and vice versa.
Oh, okay.
So because the piece is segmented and it stays in as one unit, it doesn't move laterally. Implants don't like lateral movement and lateral forces. So this way they actually heal better. They're splinted together. If it's just a single unit, we do still recommend waiting the 3 months after implant placement before a crown is attached. But in this case, you generally don't have to.
Okay, so if you do the whole thing, then basically you get,
we put the teeth on,
amazing, right away.
And technology has changed a lot too. So now we do guided, which minimal healing time. Everything's planned out digitally, so it's in the right spot, which is great for patients.
Wow. So tell me a little bit about your backgrounds. I'm sure our audience wants to know.
Yes.
How did you two meet? And, give me a little bit about your background. It's good if they know.
Yeah, absolutely.
No, for sure.
I'm glad I want to, I want to know.
So I'm actually born and raised from New York. So I've been there all my life. Just moved out here a year and a half ago.
Welcome.
Thank you.
I'm from the suburbs of Chicago, northwest suburbs around Schaumburg, Hoffman area.
Oh, okay, that's wonderful there too.
Yeah, so we actually went to school together. We met 8 years ago, and we've been best friends since basically the first day of school. So we decided after practicing in Chicago and New York for some time that we were going to move out here and open our office together. And it's been fantastic. It's really awesome to have someone to lean on, and
well, sure,
we can
there's
do things
two
together.
of you.
Exactly.
So you got a backup all the time.
And our patients feel it too. They see that we're best friends, joking. A lot of times in middle of treatment, we'll call one of us over, and then they start laughing like, "Oh yeah, we could see us for it." So,
well, that's good. So you have a pretty good sized office.
Yes.
Yeah.
And where are you located?
So we're off on nearby Sunset and 215, also on Fort Apache and Post Road. So near Southern Hills Hospital.
Okay.
Yep.
They're right down the street?
Yeah. A couple minutes.
Oh, okay,
yes.
Cool.
Very close.
So Summerlin, here we come, huh?
And we just about to hit our 1 year, so 1 year of opening, so we're very excited, yes.
So you do sedation also?
We do, yeah.
Okay.
So I do IV moderate sedation for patients. So it's a great way to get dentistry done. The dental office isn't most people's favorite place to be.
No.
And a lot of it has to do with the sounds and maybe the perception of discomfort when you're getting things done, or actual discomfort. And IV sedation takes away all of that. Yes. You get to be in a state of deep relaxation. We say you wake up essentially later, but really you're not sleeping the entire time. So we can have a conversation with you, but patients don't remember it because of the drugs.
That's good. I like drugs. Drugs are my new best friend.
So really, really awesome way. I do my wisdom teeth that way. Our implants sometimes
even like deep cleanings and stuff like that.
Yeah, a lot
right?
of patients. Some patients can't do a regular cleaning or really anything, and this is a great option for patients. Who are we to judge someone else's past experiences?
Sure.
So we just offer it for any of our treatments.
Yeah.
We actually designed our office to be more of like a spa calming environment.
That's great.
Yeah, so we have TVs in the ceiling, we have essential oils, blankets, headphones, really try to take away the dental
That's
atmosphere.
the way to go.
Exactly.
Yeah.
Stress balls, everything. Yeah, just to make your experience there very calming.
Wow.
Yeah.
That's amazing.
Even the scent. Like as soon as you walk in, it smells like a hotel.
Does it really?
Yes.
Oh my God.
Yeah.
That's
because everyone knows that old dental office smell.
Yes.
You can smell like the eugenol, like the medication. You know.
Yeah.
We just wanted to get away from that. Just kind of change. This is kind of like a you day. You get to have your own little spa day at our office.
Well, that's even better.
Cool.
Yeah.
Yeah.
And one of the great things is we basically do almost every procedure in the office. So
you do?
we rarely refer out. So a lot of patients like to go to one place to get everything done.
Absolutely.
Yeah.
I know I do.
Yes.
I want to know everything's taken care of right there.
Exactly, yeah. And between both of us, we've had extensive training. So we've done a lot of continuing education courses just to be trained in all these procedures so we can provide it to our patients.
So the latest and the greatest and the best.
And we're always continuing to learn.
Mm-hmm.
Yes.
Okay. Well, how many people are in your office, if you don't mind me asking?
Staff-wise?
Yeah.
Yes.
8?
Total 8 of us right now.
Okay.
Yes. Mm-hmm.
That's great.
Yeah, and we're looking forward to growing even more, actually. So, yes.
So what are some of the other services you provide?
So we range from cosmetics. So I do more of the cosmetic side. So we do veneers, Botox, lip fillers, PDO threads, cosmetic gum surgeries. We do Invisalign. He does a lot of the major surgeries.
Anything from root canals, wisdom teeth, IV sedation, like we were talking about, extraction, grafts, ridge augmentations, implants.
Well, you really are a one-stop shop.
Yeah, we literally do.
We did a lot of postgraduate studies for it. Avin even did 2 years of residency, and along with a year as an attending, so he was teaching at a hospital.
Oh, wow.
So
that's wonderful.
we had a lot of experience in a short amount of time.
Yes.
And we love offering it for patients. We're just really obsessed with dentistry. So,
how would somebody get a hold of you, if you don't mind me asking?
We have multiple different avenues. You can call us at our office, which is 702-706-8865. You can also book online. If you search us on Google, Yelp, on our website, there's actually a way to book an appointment through there.
Okay.
Or via email, whichever way. Yeah.
Or Smile Oasis Las Vegas.
Yes.
That's generally where
you can find us on Instagram, on Facebook,
TikTok.
We just started doing TikTok videos.
Yeah.
So you're into everything.
Yes.
That's wonderful. Yeah, what's nice is to be able to pull the curtain down and be able to talk to somebody about all the things that we all want to know. But what's even nicer is the fact that you have everything there. Mm-hmm. It's not just limited to, pulling a tooth, you have everything.
Yeah.
But the Botox too.
Yeah. Mm-hmm. And the one thing you'll get to know about us is we're very open. And even if you want to stop by, just take a look at the office. We invite you. We even actually sometimes go get dinner or invite our patients over and get to know them that well too.
Oh, that's good.
So
that's wonderful.
Yeah. Mm-hmm. We want to be part of the community. So we'll join like chamber events or go to some meetup groups just to meet patients and meet people out there. So,
that's great. That's great. So what are you hoping for in the next 5 years? What do you see in growth?
Yes,
as long as we're asking questions, we might as well ask all the questions.
We just continue to chase our passions, chase our dreams. Continue to do the procedures and things that we love to do, change patients' lives, and really make an impact in the Las Vegas community.
Yeah,
I think you're doing
that. And then be reliable. So our patients love the fact that they can call us or text us, and we're always.
So if something happens, we have your number to be able to call.
We even came on holidays. Like I remember, I came in on Thanksgiving. We came in on Christmas. So if an emergency happens, we're readily accessible.
Oh, that's good.
Because we all know what it's like to have an emergency.
Oh, and you're sitting there and
Mm-hmm.
and what am I going to do?
Exactly.
What am I going to do?
Yeah. And our patients appreciate it just for us to come in, and our staff is readily available too.
Well, I think Las Vegas needed you both.
Thank you.
So going forward, I'm going to definitely have you on as regulars.
Yes.
So this is Invisalign. This is dental implants, but the Invisalign is a whole nother story to talk about too, isn't it?
Absolutely,
yeah. And then talk about the Botox. And do you have like different specials that you do with the Botox? And
yes, we do. So from time to time, we'll offer summer special just throughout the year. So yeah, we do.
Okay.
And Botox can be used for a lot of things.
Yes.
Dr. Avin uses it for clenching and grinding your teeth,
Jaw pain.
for jaw
really?
pain,
Yes.
for headaches, migraines. Yeah.
Well,
I actually got mine done a week ago.
Yeah. a week
And
ago.
it feels totally different. I was clenching my teeth quite a bit, and it really loosened up my jaw and the morning tension,
With the
headaches, and neck
Botox?
pain.
Yeah.
Even the neck pain has gotten a lot
neck
better.
pain,
I was
too.
getting
Yeah.
really stiff,
Oh,
and I
I
thought
get
it was
that.
from my, I thought it's because we practiced looking
Yeah.
down all the time. The Botox changed it big time for me,
Did
so
it
I'm
really?
a huge believer now. Yeah,
Yes.
took me a
Yes.
while to get there. So I'm like,
I was telling about the benefits of it.
It's hard
Yeah.
for dentists to start taking care of themselves because we're like,
Well,
we're
sure.
always spending
Yeah,
so
'cause
much time with our
you're-
patients.
Yeah.
So I'm like, you know what, Alvin, we just got to block out time and let's just get this done. So I did it, and I mean, really, it's totally 180.
Yeah, I also did it myself too. So one of the great things, and which we'll touch upon in a different segment,
Isn't
is
this fun?
Yes.
Honest to God,
Yeah.
you need to give us a thumbs up. You need like, subscribe, and share, because we're going to talk to these boys a lot more. I can guarantee.
Yeah, and honestly, a lot of the public patients, they don't know about it. They just think
No.
night guard, but actually, just getting the relief with Botox helps a lot. And everyone hates wearing night guards at
Oh
night.
yeah.
So if we can find that, that's
But
definitely
the
something.
clenching the teeth and also the neck.
Yeah, so we can get into trigger points. Sometimes there's what we call knots that we can.
Oh, I
break
get
up for.
those.
Yeah.
I need to book an appointment with you too.
Yeah.
Also,
Definitely.
PDO threads, collagen. So there's so much.
What's a PDO thread? I'm going to act stupid here.
So
what's a PDO
thread is
thread?
basically this suture, this resorbable suture we place in your skin, and it helps stimulate collagen. So it actually
really?
will tighten the skin, kind of give you
Okay,
a
I'm
fresher and good
coming
look. So
over.
yeah, and it's great, especially with facial aesthetics going in,
Sure.
smile, lip, everything. It's a big factor into our face. So yeah.
Wow.
Yeah.
Wow, this is awesome. Boys, I live at the Ridges. We might have to do a Botox party over there
Yes.
and talk to everybody, you know.
We'll be there.
Oh, we'll definitely be there.
You'll be
Yes,
there,
we'll
okay.
definitely for sure.
Well, we're going to have to set that up. That'll be continued, in my show, definitely.
Yes.
So going forward, the next thing we're going to talk about is, what are you going to talk about next when I bring in?
Actually, I think the great next topic would be Botox.
Oh, I think so,
and
too.
even gum fillers. So a lot of times patients have dark triangles, or their gums are receding. So
Sure.
there's actually products to help
Is
get
there
some
really?
growth. Yeah, if you don't want to go the surgery route, so it's kind of an alternative.
Okay, now see, that brings me another question.
Mm-hmm.
All right, so I had gone to all these different dentists and for the cleaning, what do they call that, where they do the in the gums?
Deep cleaning?
The scaling and root
cleaning.
planing,
Yeah,
essentially.
yeah.
Mhm.
Okay, so do you still recommend that, or do you recommend gum fillers? Or?
Yeah, so you still have to get your
Deep
deep cleaning.
cleaning.
Yeah, just because that's an active gum infection. So we want to make sure everything's stable.
Okay.
This is more from patients who, brush too hard, or they clench and grind and there's some recession. This kind of helps cover that up. So less
really?
sensitivity. Yeah.
Oh, okay.
Yep.
Well, that's good to know.
Yeah.
Well, I can't get over all the stuff you do at your office. Wow.
Yeah, we're very excited to offer
So,
all
so
this
you're
stuff.
kind of like a
patients.
one-stop shop, aren't you?
Yes.
Oh yeah, and we try to be. It's
Yeah.
it's nice for us to be able to offer patients all of the options, and
Right.
just having a really comprehensive knowledge on all of the things that we can offer gives patients at least the ability to choose what they'd like to do, and
Yeah.
how far they'd like to go in terms of fixing their teeth.
Oh, absolutely. So you fix your teeth, fix your face,
Yeah.
fix your neck.
Exactly.
Listen, the smile is just one part of the face, so you want to take care of everything.
Oh,
So,
my goodness. Well, you know what? We've covered a lot today,
Yes,
haven't
we have.
Yeah.
And it was actually a lot of fun,
Yeah.
especially, educating patients on what's out there.
Oh, absolutely.
Yep.
because most people are afraid to ask the questions.
Of course, yes.
And then when they go in, they don't want, you don't want to feel stupid, and then you're afraid, if somebody tells you that it's this price or that price. But see, you give different options.
Yeah, and
Different
funny
prices.
enough, wherever we are, even if it's on the airplane, I'll talk to my seatmates, and
Sure.
the first thing they'll be like, oh, I have this question. It's like, we're totally open with, giving our take.
We love
Is-
it. No
is-
gatekeeping here.
No, yes, exactly.
But you see, that's what you want.
Yeah.
I mean, you're welcome addition to Las Vegas. You're a breath of fresh air, and the fact that you're totally open, to me, that's a big deal.
Yeah, and literally an entire flight, 2 hours just talking about dental. I was like, I'm pretty sure everyone's gonna be tired of hearing about teeth, but it made their day. You know?
Sure it did. Yeah. Well, it made mine. I'm sure it made our audience too. So again, be sure to like, subscribe, and share. We're going to have many more sessions with these guys, Smile Oasis, and be sure to tune in to Suzy's Las Vegas. We'll let you know when the next show is, and we hope you subscribe. Talk to you soon. And Avin and Kamal, thank you. And what is your parting words? What do you want to say to everybody before we say goodbye?
Oh, yeah. Thank you so much for having us. Yeah. It's been a pleasure, and we look forward to seeing you maybe in our office or maybe out about in Las Vegas sometime.
Yeah, even as friends.
Yeah,
yes.
Absolutely. Well, you heard it here first. See you soon.
Thank you.
Take care. Bye.
Bye.